A lot of activity has flowed into the healthcare space. Now, look at things like Merck recently. Merck, has been a terrible stock, terrible performer. And all of a sudden, over the last week or two, the stock has spiked up. Everybody's got to own Merck. For what reason? I wonder, and I shake my head at some of those trades. But I think if you look towards, some other names in the healthcare space or even in the consumer discretionary space, you don't have to take on a whole bunch of risk.
How do you identify an exhausted trade? Liz, you say boring holdings are a valuable part of any portfolio, especially during the recent volatility that we've seen. So walk us through what you mean by that and where are you looking for these so-called boring holdings?
To my mind, that's when that full diversification comes into play. And I talk about the parts of the portfolio that felt boring over the last year or so, like a healthcare holding or a food and beverage kind of holding, which really weren't participating in last year's strength. But as an investor, you really have to sit back and wait to see what kind of policies we're really putting in place.
And so as we're waiting for those policies to really be clarified, who are some of your top picks in your portfolio management strategy right now?
So I'm going back to what we call those boring stocks, like Johnson & Johnson, a wonderful long-term holding. The stock has sort of traded in a range for a couple of years. The fundamentals are fine.